Recording. Hello, everyone, and welcome to our next series of the Doc-U. This is Paula Matarese, Vice President of LAF Organization, and today I'm welcoming Dr. Rosalyn Stewart once again, who is a board-certified pediatrician with Johns Hopkins University, and we are going to be talking about parenting in the time of COVID. Dr. Stewart, go ahead.
Thank you, Paula and LAF. I'm happy to be here again today. Before I answer any questions about parenting and COVID, I just want to give you a little tip for how to have good parenting. I think the first #1 rule for good parenting is for parents to take care of themselves. You really need to be in a good mindset in order to do a good job taking care of children. And so what I mean by that is that parents should have good nutrition, good exercise, and some time to themselves every day in order to have the perseverance and the focus in order to have the patience needed for good parenting during stay-at-home orders. With that, I'm happy to take any questions that you guys might have.
Hi, Dr. Stewart. This is Marcus. I just wanted to ask a question for my brother. So my nephew is having some difficulties understanding why he can't return to school and why he can't see his friends during the pandemic. Do you have any advice for my brother to help Charlie understand what's going on during the pandemic?
Thank you, Marcus. That's an excellent question. Many kids are very confused about what's going on and why everybody is staying at home. I think talking with children in very plain and simple language about what is going on is very important. You could say that there is a virus that is going around the world making people sick, and it's important that people stay home in order to not get sick. When you're in close contact with other people, you can get sick. The other thing, and there are things that we as a family can do to prevent us from being sick. For example, we can wash our hands for 20 seconds. And when we touch things, wash our hands frequently. That will help explain why you can't go to school, because school is where lots of kids are together. But then you need to address the fact that now Charlie can't see his friends. And really you have to do that directly. You can say to Charlie, I know that you're upset that you're unable to see your friends. And then give the power to Charlie. Let him help decide how could you address that together. Say, Charlie, would you like us to try to set up time by Zoom or by FaceTime to talk to Charlie, to talk to your friends so that you can spend time together. It is really important in this time of COVID that parents not only plan some social activities for them with their friends over the internet, but also social activities for their children with their children's friends over the internet.
Thank you, Dr. Stewart. I will pass that information on for sure.
You're welcome.
Dr. Stewart, I have a lot of my friends who are parents complaining about dealing with their children's boredom. They want to sit on electronics all day. That's the only time they're happy is when they have computer time. How does the parent avoid giving into that?
Paula, thank you. That's an excellent question. So yes, there's a lot of data about screen time and how it affects your children. But I think the important thing to know now is that you can use screen time for good. For example, with homeschooling, you can contact the teachers or go to PBS Kids and find educational television for your children that is age appropriate. You can also go to websites like Common Sense Media and find internet games and exercises that you can do with your children as a family. So screen time doesn't necessarily have to be bad. At this time, with good planning, it could actually be used for educational and other beneficial purposes.
Thank you, Dr. Stewart.
Dr. Stewart, this is Francie. I understand that depression is hitting somewhere around 1 out of 3 children during this time of isolation. Do you have ideas on what we should be watching for, and what do we do if we see it?
That is an excellent question, Francie. Yes, with social isolation for people of all ages, it can make people feel sad or depressed. And again, addressing these concerns directly is the first thing to do. If you notice that children are sad or mopey, ask them about it. Say, I understand that you seem very sad right now. Tell me why. Tell me what you are thinking so that you can talk through their fears together. Although sometimes children just have behavioral changes when they have depression. They might be acting out more or breaking more rules or just causing more trouble. And the answer is not to have increased punishment, but to think about why they're feeling and acting the way that they're acting. Some of the ways to help avoid these feelings of anxiety or depression in children is to make sure that you maintain a schedule during all these uncertain times. Get up at the same time, have a good, healthy breakfast, have a schedule where, maybe school is in the morning and after a lunch, a good, healthy lunch, have exercise and other activities in the morning, and then maintain your 3 important B's at night: book, brush, teeth, and bedtime, to make sure that your nighttime routines stay intact. So having routines are very important. And at the same time, the routines should not be all about the children. So you should set up a time that is school time for the kids and work time for you. And maybe while you're working, that's when they could be watching some of these educational programs on TV. It takes a lot of organization today to stay caught up and to stay such that kids feel included in daily activities. But if you include them in your planning and in your activities, generally that will reduce their anxiety and their worry.
Thank you. That helps.
And with that, this concludes our docu-series on dealing with children in the time of COVID. Thank you, Dr. Stewart, for again sharing your insights and your knowledge about this topic. Hope everyone enjoyed.
My pleasure. Thank you.